Okay, so this is part two of knowing your fetal movements. If you have been following me, you know, if you watched the first video, I was trying to explain how you know excessive fetal movements, reduced fetal movements, you know, when you start noticing your baby's movement, and it's very, very necessary. If you're pregnant, you need to listen to this video. So I was talking about counting or tracking your fetal movements, your baby's movements. You know, you have to know your baby's movement because it will help you a lot. So I was trying to, elaborate, the number of times a baby is supposed to kick in 1 to 2 hours, in 2 hours, like up to 10 times. And I was saying that within 2 hours, your baby is supposed to have kicked at least 10. But this varies, everybody is not the same. Some women may have five, three, four, you know, there should be a pattern. So that is why it's very necessary for you to study how your baby moves. So that when there is an excessive movement, you know. When there is a reduced fetal movement, you know. Some women, position can affect the movement of the baby. So if you're not keeping track of this movement, how will you know your position is affecting your baby? Some women, when they lie down, maybe lie down in an abnormal position, you see the baby start moving. The baby will start moving so fast. Do you understand? Some women, maybe while they are doing their domestic work, maybe the position you are staying to do that or wash or sweep or do that, you find the baby, there's an excessive baby movement that signals that something is wrong and the baby is not comfortable. And if you're observant, you know. If you're very much observant, you know, and you have to adjust. What the baby is trying to tell you is that adjust, I am not comfortable. But most people don't take notice of all this. So the baby is trying to tell you to adjust, I'm not comfortable. So when you start noticing excessive fetal movement, check your position. Maybe the way you're lying, the way you're sitting, your position, the way you're doing your half shot, the way you're bending. It's not good for a pregnant woman to be bending. Excessive bending is not good. It affects you, especially when the abdomen is protruding. It's not good that you bend a lot because as you're bending, you may be compressing some blood vessels supplying to the placenta. So most times where you have fetal stillbirth and death of fetus is when there's a reduced blood supply to the baby. So your position can cut off blood supply. So that's why sometimes there are things you'll be doing and you notice that the baby is moving excessively. You adjust. When you adjust, you see that the baby will, the excessive movement will stop. So apart from that, if you start noticing excessive movement, then you change your position, do this, do that, and there is still an excessive movement for some time.